Premiers and territorial leaders are repeating their calls for more healthcare money. They're in Victoria for the first in-person Council of the Federation since 2019, and they're pushing for a meeting with the Prime Minister to discuss funding.
As soon as possible. As soon as possible. It's overdue, and so we need to make sure this happens.
This is larger than politics. This is, about ensuring a sustainable healthcare system, not just today, but into the decades ahead.
I believe the Prime Minister understands the urgency of it, but my message to everybody out there is the patient in the gurney, and when you're standing at the end, don't care who pays for it. They just want Canadian-level care.
For more on this, Dominic LeBlanc is the Minister of Intergovernmental Affairs. He's in Moncton, New Brunswick. The country's premiers just held a press conference calling for more and recurrent money for their struggling healthcare systems. Premier Horgan told my colleagues on the House premiers have been, quote, ghosted by the federal government. As Prime Minister Trudeau said, they would discuss funding once the COVID pandemic was under control. So the question, when will those talks with the provinces actually happen?
Well, obviously, Paul, we haven't been ghosting the premiers on healthcare. In fact, I spoke to Premier Horgan yesterday on this very issue. I spoke to Premier Ford last week. I spoke to Premier Fury of Newfoundland and Labrador. My colleague Jean-Yves Duclos speaks to provincial and territorial health ministers all the time. We have shown Canadians and certainly provincial and territorial governments, Paul, that we have been extraordinarily present, including financially, in supporting them through COVID, through the pandemic, supporting their healthcare system, $72 billion additional dollars alone in the fight against COVID, including $2 billion for wait times as recently as 2 months ago. We've also said that we would continue to work with the provinces on long-term sustainable funding that provides the excellence and the resiliency that Canadians understandably expect of their healthcare system. So our record of supporting provinces and territories with healthcare funding is real. The other thing, Paul, is COVID has also changed the fiscal relationship as between the orders of government. We spent massively to help Canadians and provinces through COVID. Provinces now, in some cases, are running up big surpluses. Some provinces are deciding to send $500 checks to people at the cost of billions of dollars. That money can be used immediately. Those surpluses and those spending decisions, that money can be used immediately, for example, in the Health Human Resources Challenge. But we will also continue the conversation and arrive at an agreement to support provinces and territories with additional healthcare funding. But Paul, we don't want to pay for their surpluses or their tax cuts. We want to pay for outcomes that improve the public healthcare system. That's what Canadians expect the federal government to do. Okay,
look, and I don't want to get too deep into the numbers weeds here, but the premiers say they pay, 78% of healthcare costs. The feds, they say, pay 22%. Your government uses a different calculus. We can, get into the numbers game, but the bottom line is they want more money. How far are you willing to go?
Well, Paul, the fact that they want more money unconditionally from the government of Canada is about as old as Confederation itself. You weren't born, Paul, when they had the first meeting to decide they wanted more unconditional money from the government of Canada. What we have said is that right now, the federal spending to support public health care is about a third of all the spending. They use this fake figure of 22% because they deliberately refuse to acknowledge that $20 billion was generated last year by provinces and territories in tax points that the government of Canada withdrew from, and they then took up immediately to generate revenue for themselves. So those tax points, for example, represent $20 billion of spending that they got from the government of Canada last year. So their 22% figure isn't real. But what we have said is that we are prepared to make additional investments in the healthcare system. That was the subject of my conversation with premiers, including, as I said, Premier Horgan or Premier Ford last week. We will obviously be there to do more, but we want to work with them to ensure that that additional investment gets the results that Canadians expect. And Canadians understandably want their emergency rooms reopened. They want some of the shortages of personnel addressed. And the provinces have to lead on that, and they have the fiscal capacity to start that work now. And we'll continue the conversation and do more with them as well.
And as you know, they want to be able to do what they want to do in their provinces. They talk about not having any strings attached. Do you see an end game here where there are no strings attached to federal money?
No, of course there'll be strings attached, Paul, in the sense that we're not going to increase the federal spending to provinces for healthcare so they can then reduce their own spending. That would be absurd. They say they need more money. Well, if we're going to increase the federal spending, at a minimum, we would expect that they maintain and increase their own spending at the rate that they expect us to. We would also expect that that money not be used to run up huge surpluses, as many of them did with federal monies during COVID, or to send checks to people on the eve of an election. If we want to work collaboratively to strengthen public health care for the long term, that's what Canadians expect. That's the Prime Minister's commitment. And we're prepared to have those conversations over the next number of weeks and months. And I'm optimistic, Paul, and I said that to Premier Horgan yesterday. I'm optimistic that we will arrive at an agreement that will be good for Canadians and will produce the outcomes that Canadians expect all of us to work on collaboratively. All right. I'm sure the premiers will hold you to your optimism. Thanks for talking with us today, Minister. Great, Paul. Have a great evening. Thanks for inviting me on the program.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.